Hello everyone, welcome to our discussion for today. First aid is an immediate and temporary care given to a person who has been injured or suddenly taken ill. What are the objectives of first aid? To alleviate suffering, to prevent added injury or danger, and last, to prolong life. Characteristics of a good first aider. 1. Gentle means it does not cause pain and panic. A person must have a tender nature to the patient. 2. Observant, notice all signs, be aware to the status of the patient. 3. Resourceful, makes the best use of things at hand. They are able to think creatively. 4. Tactful, does not frighten the victim. He must be sensitive and respecting a person's feelings. 5. Sympathetic, comforts and reassures the victim. It pertains to a special affinity or mutual relationship. Common injury encountered by officiating officials and athletes. Sprain is caused by torn fibers in a ligament. Swelling and bruising are some signs and symptoms. The ligament can have a partial tear, or it can be completely torn apart. Ankle sprains are the most common type of sprain. Heat exhaustion is a response to heat characterized by fatigue, weakness, and collapse due to inadequate intake of water to compensate for loss of fluids during sweating. Other serious injuries that require immediate care or first aid include sprain versus strain. Sprain is a stretch or tear of a ligament, the band of connective tissues that joins the end of one bone with another. Strain is a twist or pull and tear of a muscle or tendon, a cord of tissue connecting muscle to bone. Knee injuries is the most commonly injured joint and can result from a blow or twist to the knee, from improper landing after a jump, or from running too hard, too much, or without proper warm-up. Fractures is a break in the bone that can occur from either a quick one-time injury to the bone, acute fracture, or from repeated stress to the bone over time, or stress fracture. Dislocations, when the two bones that come together to form a joint become separated, the joint is described as being dislocated. For example, the top of your arm bone fits into a joint at your shoulder. When it slips or pops out of that joint, you have a dislocated shoulder. You can dislocate almost any joint in your body, including your knee, hip, ankle, or shoulder. RICE method. Rest. The injured part, especially for the first 24 to 48 hours after the injury, this is the most critical time of treatment. Avoid any activity that causes pain or makes it worse. Use crutches if the leg, foot, or ankle is injured. Support an injured wrist, arm, or shoulder with a sling. Tape an injured toe or finger to its healthy neighbor. Ice is an excellent anti-inflammatory and reduces swelling and pain. Apply an ice pack or cold compress for 10 to 15 minutes as soon as possible after an injury. Repeat each hour for the first 3 or 4 hours, then 4 times a day for the next 2 to 3 days. Protect your skin with a thin cloth. If ice packs are not available, a packet of frozen vegetables in cloth will do. Compression also reduces swelling. Use elastic bandages for at least 2 days. Check that the bandage is snug, but not too tight. Take the bandage off at night. Elevation drains fluids from injured tissues. Elevate the injured area whenever you are sitting or lying down. Try to keep the injured area at or above the level of the heart. To find out if you learned something to our lesson. Answer. Activity 1 titled Name It. Direction. Identify the name of the following materials in the first aid kit. Choose the answer inside the box. The following choices are gloves, scissors, thermometer, safety pins, bandages, tweezers, first aid manual, needle, adhesive tape, antiseptic wipes, triangular bandage. Activity 2. True or false? Direction. Read each statement below carefully. Place a big T on the line if you think a statement is true. Place a big F on the line if you think the statement is false. 1. Don't try to diagnose or treat a broken bone yourself. 2. The importance of first aid is it enables you to assist persons who become injured in the event of an accident until help arrives. 3. A first aider is someone who has lack of knowledge in carrying out a first aid in emergency situation. 4. Self-care measures for an injured knee include RICE. 5. A more severe sprain or strain may require evaluation by a first aider. 6. Rehydration with water or a sports drink is the cornerstone of treatment for heat exhaustion. 7. First aid treatment for heat exhaustion includes recognizing the symptoms, stopping the activity, and moving to a congested environment. 8. Dislocation is most common in shoulders and fingers. 9. Mild sprains can be successfully treated at home. 10. Active compression helps improve blood flow, thereby enhancing the delivery of oxygen to damaged tissue. Knowledge is power. If you learned to our topic for today, for more updates videos, please like, share, and subscribe to our channel.